Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at HAIRLICIOUSLY.com to purchase our microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to talk to you more about the use of Dutasteride, aka Avodart, for the treatment of androgenic alopecia. As you may know, Dutasteride is a much more potent form of a 5-alpha reductase inhibitor compared to finasteride, and it will wipe over 90% plus of systemic DHT levels in the body. People who are taking it, who end up getting blood work to see where their systemic DHT levels are at, usually report close to 100% suppression, with some people with levels so low that it doesn't even show up. So it is very potent, and it will more than likely take you back to your pre-puberty levels. So I actually came across this website a few years back, which is now archived, but I really never got a chance to do a video on it. But basically, twinshairloss.com features identical twins who were afflicted with genetic hair loss. One of the twins decided to take action and take oral Dutasteride while the other didn't, at least not initially. And the results, not surprisingly, were just so drastic between the two in terms of hair regrowth and density. And studies like this are pretty rare. You don't see too many twins who have genetic hair loss with, one taking medication and the other not taking anything. And this really gives us the opportunity to visually see how good 5-alpha reductase inhibitors really work for most people. Usually we can't really tell how the hair would look like if you didn't start finasteride or Dutasteride. So moving over the website, it says, since my twin brother, twin A on the left of all photos, started showing signs of baldness in 2003, he has treated his hair with a whole variety of products. Fortunately, he has managed to prevent his hair thinning that I have experienced by taking a DHT blocker known as Dutasteride. I, with twin B on the right of all photographs, didn't try anything up until January 2010 to prevent losing my hair, not intentionally, and the results are clear to see. So the first set of photos was taken in 2013 as stated, and you guys can clearly see that the twin on the left had started Dutasteride in 2003 on the first onset of initial hair loss, while the one on the right didn't take it until 2010. So that's nearly 7 years of being on Dutasteride for the non-balding twin. And this photo here depicts what the twin on the left could have looked like had he delayed his treatment until 2010, like his twin brother has. And this is key because, the earlier that you guys start treatment, the easier it is to stop the progression of hair loss or at least slow it down. The twin on the right started his treatment years and years after he had already experienced moderate hair loss. And, this photo here shows the limitations of even something like as potent as DHT. As the twin who started treatment later down the road, still is far behind the first, and shows that hair loss that is still more extensive can sometimes never return back to baseline, even on something, like I said, as potent as Dutasteride, while the twin brother who took it earlier on the first onset of hair loss was able to reverse his miniaturization and retain most of his hair. Now, this next photo was taken in 2009, and you can see how much ground the twin on the right has lost as a result of not starting, hair loss medication. We can see some pretty extensive hair loss on the upper, mid scalp and crown area, whereas the twin on the left who had taken Dutasteride for the past 6 years showed no signs of any miniaturization. It might look like the twin on the left has some slight thinning, kind of like in the crown area, but it's absolutely nothing in comparison to his balding twin brother. So here's a better shot of the crown area, and we can see the extent of the thinning. Now moving on, we can see the frontal, the hairline area for both twins with the photo taken in 2009. Once again, the twin on the right side of this photo was not on Dutasteride, while the one on the left was taking Dutasteride. And it's crazy to see, a side-by-side comparison of how the hairline could have looked like for the twin who had started treatment in 2003. The twin on the left is literally like a Nord 1 now, and at this point, there is no signs of hair loss anywhere on the scalp, whereas the one on the right has a receding hairline. He has thinning on the mid scalp and the crown area. And due to the extensive nature of his hair loss, I would probably place him, somewhere around a Nord 5 or Nord 6. And then the last set of photos here show some with the twins in their childhood to illustrate, I guess that they both had the same amount of hair throughout their teens and early adulthood. However, like their father, as you guys can see, baldness was soon knocking on the door, and one of the twins decided to let hair loss take over while the other prevented it by taking Dutasteride. He further mentions, quote unquote, "We are the only identical twins in the world to have tested Dutasteride for use in hair loss prevention for as long as 5 years, with one twin taking the drug once a day and the other foregoing any substance or method to preventing thinning. That was an accidental trial because I didn't really think at the time that there was a viable solution out there. So just ignore the problem." The results my twin brother had experienced had been incredible, which is why I wanted to share this experience with everyone. As I mentioned, the test was purely accidental and not deliberate. My twin brother was more concerned with his hair loss at the time than I was with mine. It took me a further 5 years to actually be concerned enough to act when my bald spot became a lot more prevalent. I'm sure most men are like me. They wait for clear confirmation that something is happening, and then they decide to act as opposed to listening and dealing with the problem early on. However, the truth is, even though I am balder than my twin brother, in case you fail to see the relevance in me and my brother being twins, I will explain further. We are monozygotic twins, which means identical twins, who virtually have identical DNA. There is some possibility that we may have variations in CNV, which is copy number variation, in a few areas, but on the whole, our makeup is the same. Therefore, we are both prone to the effects of male pattern hair loss. However, early on in the process of twin A's hair loss, he started using Dutasteride to combat his receding hairline. This is why he shows only small signs on the crown of his head and none on the front. My hair receding, on the other hand, progressed at a normal rate. All other factors in our life remained the same. We both did sports regularly, shared similar diets, and grew up in the same environment. Now, I was actually able to find a study that was published back in 2007. It's titled "Dutasteride Improves Male Pattern Hair Loss in a Randomized Study in Identical Twins." So the objective was that the study compared the efficacy of Dutasteride versus placebo in the treatment of male pattern hair loss, androgenetic alopecia, in 17 pairs of identical twin males. So that's a lot with androgenetic alopecia over a 1-year period. In this randomized, double-blinded, placebo-controlled, single-center study, one twin from each identical twin pair received 0.5 milligrams per day for 12 months, while the other received placebo for 12 months. Hair growth was evaluated using standardized clinical photographs, hair count, and patient self-assessment questionnaires. The result: Dutasteride significantly improved hair growth at 1 year compared to placebo based on the analysis of the investigator assessment and the patient self-assessment questionnaires. 16 of the 17 twins completed the study, of which 15 sets correctly predicted the use of Dutasteride. Only one set could not determine the active drug from the placebo. In conclusion, through the use of identical twins, this randomized trial provides evidence that Dutasteride significantly reduces hair loss progression in men with male pattern hair loss. So, the study further validates the experiment the twins saw from their use of Dutasteride. Dutasteride, however, unfortunately, is not FDA approved for the treatment of hair loss in the US. But if you go to places like Japan and Korea, they actually have it approved for treating hair loss because of its greater efficacy than finasteride. So most doctors will prescribe Dutasteride over finasteride. And just like finasteride, Dutasteride has been used for treating enlarged prostates for a couple of decades now. The good news is that there's a lot of long-term studies on Dutasteride that confirm, things like the safety profile and efficacy in the use of Dutasteride for treating hair loss. Side effects do exist, like they do with any other drug, but the minority of users who experience it are able to reverse it after cessation of the drug. Anytime you are altering your hormonal profile with a 5-AR inhibitor, there's always the potential to experience side effects. So, at the end of the day, it really comes down to how much risk that each and every one of you are willing to take for the treatment of hair loss with a 5-alpha reductase inhibitor. I'm not here to tell you guys what to take or what not to take, just laying out the facts that, you know, this drug is pretty efficacious in terms of blocking DHT and even regrowing hair, slowing down the progression of hair loss and promoting hair growth. What I will say is that, you know, starting early is always key with any type of treatment. The sooner you start, the better your chances of regaining the lost hair and even slowing down further progression of hair loss. Using other hair loss medications such as growth stimulants like Minoxidil, you know, microneedling, laser therapy, anti-androgens is also going to be key in maximizing, you know, your potential by targeting hair loss through various mechanisms of action. But I will say that, you know, most people who are taking 1 milligram of finasteride will be sufficient to slow down the progression of hair loss. But studies do show that dutasteride at 0.5 milligrams obviously works even better in terms of hair count, as well as, you know, a higher efficacy in reversal of miniaturization than finasteride. Side effects for both finasteride and dutasteride were pretty negligible and pretty similar. And like I said, most people who did experience them are able to reverse it after cessation of medication. Anyway, you know, that's all I have in today's video. Hope that was helpful. Kudos to the twins for showing us the efficacy of dutasteride through their experiments and for documenting their journey over the past few years. So thanks for watching, guys. Thanks for all your support. If you guys have any questions, make sure to reach me via email or you can leave us some comments below, and I will talk to you guys in my next video. Take care.